Are you scheduled for a cesarean and you're kind of freaking out because you don't know what it's going to look like? Let's talk through it, okay? My name is Dawn, and when we see patients for a cesarean, we'll usually see them the day before, maybe two max, but we're doing a pre-op with you. And during that pre-op appointment, we're going over your whole health history, any previous surgeries, any medications you're on, any kind of other health issues that we need to be concerned about, any complications during your pregnancy or with past deliveries. We want to see the whole picture, right? And we want to get it all in the chart. We're also going to be drawing blood at that point in time because we want to see where your blood stats are and have your blood type there in the hospital. During that pre-op appointment, they're also going to guide you on how long you can eat prior to your surgery. The last hospital I worked at, we followed ERAS, which is enhanced recovery for surgery or after surgery. And so what we want to do is we wanted to let you eat until midnight prior, and then you could have clear liquids up until about 2 hours prior to coming to the hospital. But right at that 2 hour mark prior to coming, we actually wanted you to drink Gatorade or some other kind of electrolyte solution because we wanted to make sure that you were well hydrated prior to going into surgery. Also shower the night before your surgery with a special soap they gave you. And then that morning before you come in, we ask you to shower with that soap too. This is in most places. So you come on in that morning, you've got your bags and your partner. Now what's going to happen? We'll do a quick wait because we weigh everybody. We're kind of obsessed with weighing people, right? We'll do a quick wait. You don't have to look if you don't want to. We will take you to the room and we'll have you change into a gown. Now, when we have you change into the gown, we're going to go ahead and have you brush your teeth and gargle with this special type of solution. This will help decrease your chances of getting pneumonia. We'll get you onto the bed. We'll hook you up to the monitor because we want to see how baby's doing, if you're having any contractions, so on and so forth. We'll start your IV, and depending on your risk for hemorrhage, we may start 2 IVs. So after your IVs are started, we're signing consents and different things like that, making sure you don't have any questions. We're running fluid because with the spinal that you'll get for pain relief, your number one risk is a drop in blood pressure. So we want to do everything we can to keep that blood pressure up. Now, about 30 minutes prior to the incision, we'll also start antibiotics. These are called prophylactic antibiotics, and we give them to you just in case because we're breaking the skin, right? So your risk for infection goes up, and we want to bring that down as much as possible. In addition to that, we give you a little cup of Bicitra. Bicitra is a drink that you take that will help decrease the stomach acid and help decrease the chances of you vomiting during your surgery. Now, during this time, you have your nurse and maybe another nurse helping you get everything squared away. We're asking you questions about what you want after delivery. Hopefully, it's a place that will allow you to do skin to skin during the repair of the surgery because that is ideal. If we can get that baby delivered and over to the warmer and then brought straight to mom to be put across her chest this way for skin to skin during that repair, it is so beneficial for both mom and baby. So hopefully, you're in a place that will allow you to do that. We're also going to put things around your legs that will actually blow up with air and release, and it's going to keep the circulation going during your surgery and after until you're up walking around. This will decrease your chances of having a blood clot. We will take you into the OR. The OR is bright and kind of loud and really cold, and in some places, you can go in there at the same time as your partner. Other places, you have to wait for your partner to join you when they're ready to start the surgery. But nevertheless, you'll get into the OR. You'll be sitting on the side of the bed so the anesthesiologist can be behind you and put that spinal in. You'll have a nurse in front of you supporting you and talking you through all the steps that are happening. It usually happens quite quickly. We'll get that spinal in. And the worst part is the local anesthetic, which is lidocaine. That pinch and burn, it feels like a bee sting. Other than that, it goes quite quickly. They get the medication in. They remove the needle. It does not stay in the back. And we lay you down really fast because that anesthesia works super fast. We get you laid down. We put the arm boards out. Some anesthesiologists use bands around you still. Some don't. And you can request either way, depending on your situation. Oftentimes, the one where your partner is will just say, can we keep this one loose so that my partner can hold my hand? That usually works really well. The other one, you've got your blood pressure cuff on and your IV and everything. So the fact that it's kind of like stabilized isn't so bothersome for a lot of people. Now, once we've laid you down, now you're flat on your back, and we tell you never to lay flat on your back during pregnancy, right? So we're going to either put a little bump under your left side, or the anesthesiologist will tilt the table so your baby's not laying on all those major vessels. This helps protect the baby. Now, during this time, the nurse may monitor the baby again a little bit, while another nurse is actually starting your Foley catheter and getting that inserted. Once that's inserted, we take the monitor off the baby as well, and we start cleaning the belly. Now, the belly has to be clean in a specific way to help create that sterile field, right? Now, in the OR, there's lots of people going. There's the OR tech, there's the nurses. Usually there's at least 2 nurses. And then respiratory therapy is going to come in as well. You'll have your OB doctor, your anesthesiologist, and whoever else is assisting with the surgery. In some places, it could be a midwife, another doctor, or it could be the pediatrician themselves. So you'll have a lot of people coming in there. Once we know you're nice and numb, if your partner's not already in the room, that's when we call them in. And in most ORs, all the ones I've been in, as a matter of fact, the partner is over here on your left side. So they'll be sitting in a chair, talking to you and supporting you through this. Now, please be aware that you could actually see the reflection of the delivery in the OR lights. You could ask them to move them just a bit so that you could see better, or you can make sure you look away if that's something you don't want to be able to witness. Now, during the surgery, you should not feel pain, like the sensation of sharpness, that kind of pain. You will feel pressure though, and you will feel movement as they're cutting and tearing and getting in there and helping the baby out. So you will feel that. A lot of people feel like stressed about that. Others are like, it's no big deal. For others, the stress comes with the way the numbing happens. The numbing comes down from your feet all the way up. Sometimes it can come up to your chest and you feel like you can't breathe. But please note, anesthesiologist is keeping a really close eye on you. So even though you feel like you can't breathe, you are breathing, and they're monitoring your oxygen very well. We can sometimes give you oxygen at that point if it helps ease your mind a bit, but it just kind of varies from one person to the next. Now, once the baby's head is delivered, there will often be a time where the other provider has to put some pressure on the upper abdomen to help push baby on through. So be prepared for that pressure. That's usually the one that people find most intense. Now, once baby is delivered, they're on your abdomen. They'll usually wipe their face and their body a little bit with some of those sterile towels while they're waiting for that 1-minute delayed cord clamping. After that, they cut and clamp the cord. In some hospitals, they still allow dad to cut that cord. So we'll just have to find out for your hospital. Then baby's generally taken over to the warmer for a quick rub down just to get dried off. And if your hospital supports skin to skin during repair, your baby will be brought over there to you, and your nurse will give you guidance and support during that time. In other hospitals where they don't support skin to skin during the repair, your partner may be holding the baby. And then they can hold the baby and make sure the baby's skin is touching your shoulder and your neck and your face as much as possible. Any skin to skin is better than none at all, in my opinion. I think you should have full access to the breast during the repair, but some hospitals just don't support it. And if they don't, I don't want you to get discouraged, because all is not lost. The partner could be doing skin to skin until that repair is complete and you're moved to recovery. Or as soon as you guys get to recovery, you put that baby skin to skin and let the baby get over to the breast that they choose. All right. Now, once the baby is out, the repair goes pretty quick. It's not as fast as the delivery was, but the repairs can usually take between 15 minutes to 45 minutes if there's complications or other procedures being done. And so once you're able to get to recovery and do that skin to skin, that is awesome. During recovery, we have to watch your vital signs really closely, and we're still doing the fundal assessments to check for any kind of boggy fundus or excessive bleeding where we may have to do that massage, okay? And that can be excessively painful after a cesarean. Now, I know this video is long and it's a lot of information. What was it about your cesarean that you wish you would have been prepared for? Add it in the comments so others can see. And if there's any of this stuff that you didn't know to be prepared for and you're waiting for your cesarean, let us know that in the comments too.